Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And today we have a show which really emanates from a number of comments that have come to us from really support groups and others about a disease called multiple myeloma. And we have two individuals here that probably can enlighten you and certainly will enlighten me. So I want to thank them. Firstly, we have Dr. Andrew Yee, who's sitting in front of me. He's a hematologist, oncologist, and he's in the Center for Multiple Myeloma at Mass General Hospital Cancer Center. Welcome, Dr. Yee.
Yeah, thank you very much for having me.
Well, thank you for being here. And I know that it's pretty cold up in the Boston area, but believe it or not, this is our cold part of the Florida winter.
Well, it's a welcome change from the weather we had in Boston.
Yes, thank you for being here. And we have Mrs. Maynard, otherwise known as Ronnie Maynard. Yes. And she is involved with the multiple myeloma support group, which is probably, in my mind, as equally as important as the physicians who care for you. So
yes, it is. Thank you.
Thank you for being here.
Thank you.
Where do you live?
We live in Tamarack.
In Tamarack. It's a very nice city. Dr. Yee, what is multiple myeloma?
Right. So multiple myeloma is a cancer of a type of white blood cell called the plasma cell. Now, any cell in your body can become cancerous. So lung cells can become lung cancer, and colon cells can become colon cancer, for example. But when a white blood cell becomes cancerous, it depends on what type of white blood cell it is. So certain types of white blood cells, if they become cancerous, we call them lymphoma. But a very specialized type of white blood cell, the plasma cell, if it becomes cancerous, then it's known as multiple myeloma. Now, multiple myeloma is the second most common blood-related cancer. The most common blood-related cancer is lymphoma. And it's not as common as some other cancers, such as lung cancer or breast cancer. So if the audience hasn't heard of it before, well, that's not surprising. As I'm sure, as you know, when you were diagnosed, you probably were looking for resources and you didn't know anybody who had this. Like, what is this?
Right.
And so, so there are about 30,000 cases a year, and this there are several and the average age of diagnosis is someone in their mid-60s. And some of the symptoms of multiple myeloma relate to the fact that it starts in the bone. So bone problems such as fractures or bone-related pain are one of the more common features, along with low blood counts, kidney trouble, or elevated calcium, for example.
And your position with the multiple myeloma center at Mass General, which is world-renowned, by the way. Your cancer center is world-renowned, so it's an honor to have you here today.
You. Not related to me or anything like that.
No, but it is an honor to have you here because I think that our viewers take the words of our guests very seriously. And we're in our 17th year of presenting issues back to our viewers relative to their questions and the issue of multiple myeloma. And to tell you the truth, the three constant, I say top three, have always been the issue of cancer, of surgical issues, and heart disease.
Right.
So here we are talking about cancer of the white blood cells. So, Ronnie Maynard. May I call you Ronnie, or should I call you Mrs. Maynard? Because I don't want your husband to get upset.
Ronnie is just fine.
Okay, all right. So, Ronnie, tell me, because the advocacy groups and the support groups, to me, are really almost blessed groups. So talk to me about what you do.
I represent the International Myeloma Foundation. They've trained me. They supply me with all the brochures and booklets. They come whenever I need help to set it up, and I speak. Our group is about 20 people, and we invite the families to come along, and we get guest speakers each month. And I do it because this is my 17th year living with myeloma.
And I would assume, as we talk to many advocates and advocacy groups, but the issue of some of these long-standing diseases, and God bless the availability of knowledge to be able to not only keep you with your husband and your family, but hopefully for a lot longer. The support people are really very, very important.
No, absolutely. I think what we do as healthcare professionals, nurses, nurse practitioners, to physicians, that's really only a really small part of a patient's journey with cancer. And I think that what we often don't recognize enough are really, patients' spouses, family members, and caregivers who do really a lot of the heavy lifting, because we're only with the patient for maybe 30 minutes, whereas their spouses and caregivers, they're with them for the rest of the day and all night. And we really often don't give them enough credit for all the work that they do in terms of doing all the heavy lifting. And I also want to recognize also the support groups too, because I think with cancer, the more perspectives you can have on something, the better, because we have a certain perspective on it, but sometimes it's really helpful to hear from other people who are going through the same process, that they're not alone. And many times there are some things that patients might feel more comfortable talking about certain symptoms or side effects with other people who are going through the same process than with the doctor or with their nurse. So I think that it really takes multifaceted. When I think about cancer, you really have to hit it from all angles, and the treatment's just one part of it, but also having support of your team being like your family caregivers is really critical.
Okay, so now you heard Dr. Yee say, now you're going to tell me how you feel about that?
Okay. As a support group leader, I set up the monthly group and I bring in guest speakers. And last month, we had a wonderful one speaking of Darzalex, which is one of the newest medicines. And a doctor can explain it, but the nurse educator that comes to speak explains it a lot more. More side effects as to what will happen, what we look for, what the nurses will do while you're going through this. In 2 months, we'll have a dentist come. And there are side effects that do affect our teeth that the patients do need to know about. I bring in someone who spoke on, now I can't think of the word, with the little needles.
Neuropathy?
No, acupuncture.
Okay.
Acupuncture. How they can help with the pain. My situation, and each one of us, our situations are different. That's why it's called multiple myeloma. I'm one of the lucky ones. I never had neuropathy. I never had a lesion. But back then, 17 years ago, there was nothing but thalidomide, and you know what the effects of that could be, and transplants. Mm-hmm. So I've been very lucky, so I can show the others I'm okay. They see, we're able to talk as a family. I run it as a family group. I don't make it all business-like. We're a family. We can talk to each other. We meet each other socially outside. Instead of meeting 12 times a year in a doctor's office, we go out to dinner at Christmas time. We go out in the summer. I tell jokes. Uh-huh. If you don't laugh, you're going to cry. So that we're good. We're a good family group. When you come in, sometimes it's your first time. You've just been diagnosed, and all you can do is cry. I'll make a joke out of it. And look, 17 years later, mm-hmm. I'm still here. My hair's better now before the transplant, when I had none, and it came back super curly, and then it finally straightened itself out. And knock on wood, I've never been on medicine since the transplant. My numbers are still low enough that I can go on like this. I only go to an specialist. I will not go to just any hematologist, oncologist. I think the specialists who only see myeloma patients knows more, can tell us more. They're more caring for us than a regular hematologist, oncologist. And the group knows I'm there for them, that they can call me at home. I give my home number. I send out a newsletter every month that tells where all the freebies are, where you can get a free airplane ticket, where you can get rides to the doctor's offices. I just keep accumulating things, and I put it in my newsletter, and I send it out each month.
Well, that's great. That's great.
Thank you.
Thank you. Dr. Yee, let's get into some of the technical issues. I know that there's been tremendous advances in the issues of the totality of cancer treatment, and obviously at the Cancer Center at Mass General, you meet with other colleagues that are dealing with other, I should say, forms and structures of the cancer scourge. I have no other word to use for it. But the reality is that I think I'd like to enlighten the audience a bit. So if you can give us a 5-minute lecture, it would be great.
Right. So, so there's the treatments for multiple myeloma, as Robin has alluded to, they've changed dramatically in the past decade to 2 decades. So back in the early 1980s, or back in the back in the early 1980s, really the only effective treatment for it was high-dose chemotherapy, and that's pretty much almost like a sledgehammer to the system. And in the past 10 years, we've seen a range of new drugs with new mechanisms of action that have really revolutionized how people are doing with this treatment. Now, I wish I could say that the treatment is curative, but it's not curative. The treatment, it's something that we can effectively treat, and people can live with the disease for long periods of time. And then it owes to, there are 2 big main drug classes that we use in multiple myeloma. One, Ronnie alluded to it, has to do with the immunomodulatory drugs, of which the first member was thalidomide. Now, it turns out that, as the audience may know, that thalidomide was associated with horrible birth defects, in pregnant women who were taking it. But years later, people realized that thalidomide and drugs like it actually were really effective in cancers like multiple myeloma, and that really was a game changer in the field. So now we have a newer version of thalidomide, also known as lenalidomide or Revlimid, and this is a pill that you take at home, and that's really helped people live with the disease longer than before. And when people have looked at overall survival in this disease, people have found that when you look at at any interval that you look at, the survival improves over time, demonstrating that these treatments are really quite effective. So lenalidomide is one example of this drug class, the immunomodulatory drugs, and then there's been another big drug class called the proteasome inhibitors, of which bortezomib is the main example that we think of. It's also known as Velcade. And people found that, for example, the combination of these 2 drugs plus a corticosteroid like dexamethasone has shown what before was unprecedented response rates. And so it's really the introduction of those drug classes, as well as figuring out how can we use these drugs to make them better tolerated and more user-friendly for patients. So the goal with the treatments are to help people, not only to help people live longer, but also to help people live better. And people have what we're starting to appreciate is that by making modifications in the dosing and the schedule, it really helps patients able to stay on these combinations for longer periods of time.
How does the new gene therapy products and the way in which targeting is now created through technology?
One approach that's being looked at is this idea of re-engineering your T cells to attack myeloma cells. So people talk about this type of therapy, the chimeric antigen receptor T cell therapy, also known as CAR T therapy. And it's still in clinical trials, and it was more established in another type of white blood cell cancer like leukemia or lymphoma, and now we're starting to use this type of approach in multiple myeloma. So essentially, in CAR T therapy, we take your T cells, which are a type of white blood cell which can attack other, can attack bacteria or viruses. And so your T cells are collected and they're re-engineered in the laboratory to attack a particular protein of interest. So what people have found is that if you sort of re-engineer and instruct a T cell to attack a protein that's found in myeloma cells, you can find that the patients can actually get an amazing response with this type of treatment. So that's something that's still in development, and it's undergoing clinical trials.
And just to mention, because we here at Nova Southeastern University are now affiliated with the Karolinska Institute in Sweden, which is going the next step, which is the CAR-NK, I guess you could say, foci of dealing with cancer.
Right.
So I just want to make you aware of the fact that you're sitting in an institution that is now, I believe, in the epicenter of some of this, which will then move on to, Mass General and others for
right.
clinical research.
Absolutely, because I think that because the more I've done this field, the more you realize that there are all these different angles for approaching cancer, and that there are other modalities like looking at NK cells, for example, could be another way forward in terms of attacking multiple myeloma or other types of cancers.
Yeah. Well, you've been sitting here like I've been sitting here and listening to all this beautiful, wonderful scientific information, but as an individual that offers, I would say, advice and hope to your fellow multiple myeloma, shall we say, I don't want to say victims, that's a bad word,
Survivors.
Persons that are in different states of survival and also disease structure. So, but you must, listening to a person like Dr. Yee must make you feel pretty good.
Of course it does. And since I started out 17 years ago, look what's happened. There was no medicine, and now there's all this medicine, right. And more are in the works. So that if the time comes, and hopefully not, and I would need to take medicine, then at least I would have a choice and a cocktail to take. And I keep up with all of them because when our support members come in, they're all on different things. But I also find out how to help people with neuropathy and some of the other side effects, like not drinking green tea on certain days of a pill, of Velcade or one of the other medicines, where maybe somebody didn't tell them that. We give them the little tidbits that maybe a nurse or a doctor may have left out, but we add in, and we all learn from each other.
Well, that's great. Those of you, the audience knows, but my very first profession many, many years ago was a pharmacist, and I can tell you I practiced clinical pharmacy. So what I did was I would always communicate with the physicians of multiple groups, everything from primary care to subspecialists, and to make them aware of a lot of the interactions. And I'm not talking about drug interactions, I'm talking about certain foods, certain medications that they buy over the counter, especially today with so much available on the over-the-counter world, and also with the sale of so many nutraceuticals and nutritional supplements. Please talk to your doctors, And don't worry about all those lists that you have to fill out. It's very important to the doctor. So I'm just, I know what happens in Mass General. I know how magnificently structured they are. I've had opportunities to work with Columbia Presbyterian. Columbia was my alma mater. You're a Harvard guy, so I can tell you come from a pretty good school, but mine's not too bad either. But what I'm saying to you is that it must be a wonderment to you to see you and the collaborative nature of the cancer center at Mass General? Because I know you don't work alone.
Right.
Correct?
Absolutely. And I think, I think the key is, it really takes, it's all about partnerships and working with other colleagues to make sure that every patient gets the best possible treatment. Because sometimes, we all work together because, the total is more than the sum of its parts. And that's definitely best illustrated in cancer care, where we have to engage multiple people across multiple disciplines. And certainly with my other colleagues who I reach out to for, advice in terms of when sometimes you get patients with really complicated or unusual situations, and we always engage our colleagues to make sure that we have all the bases covered.
Yeah, and I know that again, pointing to a lot, we have some wonderful hospitals in the state of Florida, but pointing to Mass General and directly, I know that that they have really pioneered a lot of what I would call the multiple task hybrid ORs, even ICUs, so that there is this collaborative nature between, you taking care of a patient, and all of a sudden a colleague comes in, and it's a communicating. And I would assume that there are rounds that go on, and where you discuss cases.
Right. Absolutely.
And you have the opportunity to have the knowledge and the experience of colleagues that you hear something that you personally, I can't say, but I know it's happened to me in my life, and I'm sitting there and all of a sudden somebody gives me a piece of information. I say, I didn't know that.
Right.
I mean, there's nothing wrong with not knowing something.
Right.
Knowledge is the greatest tool you can have, correct?
Right. No, I think, Mass General is, it's a pretty large institution, but I think what makes Mass General a great place to work is that we all work together as a team. People have this, in some places or in some fields that people are like working as silos, but I think in MGH it's really unique in terms of the collaborative environment and how, the culture of the place is everyone's working at 100% to make sure everyone gets the best possible treatment. And I think what makes MGH a great place to work is it serves as a great referral hospital for people with ultra rare and unique diagnoses, but it also works as a great local community hospital for the people that live in the area. So I think that there's a unique energy that runs throughout the institution where we all we work together as one big family.
That's great. I meant to ask you. I know that, and I should have done it when I asked you or I introduced you. Where did you do your training?
So I've been in Boston since 1995. So I went to Harvard for medical school, and then I did so I might be a little bit biased about Mass General because I did my internal medicine residency there, and then I did my cancer training at the Dana-Farber program, which is combined with Mass General, and I've been at Mass General since.
Yeah. Well, I just wanted to make sure, because I really didn't lead into that, but I wanted everyone to know that. It's interesting that you and I, before we got on camera, I mentioned the name of believe it or not, of a classmate of mine that I went to high school with, who is like an icon in internal medicine at Mass General and at Harvard, correct?
Correct, absolutely.
Right. Anyway, his name is Steve Goldfinger, but he can't say it, but I can say it. It's Dr. Stephen Goldfinger. But again, let me get back to you, Ronnie, because we're down to the last 2 minutes of the show. So why don't you just look at that camera over there and tell people that they should really not resist seeking help from these support groups, whether it be your multiple myeloma group or any one of the other groups that are in some of these diseases where we just don't have a cure.
I feel that everyone who is diagnosed with cancer should go to a support group. I did originally because back then there was no multiple myeloma support groups. I went to a general cancer support group. We hugged, we talked. My biggest fear was losing hair. I felt somebody else's coming in. I wasn't so afraid. You meet and you make friends, you talk, you're in your own element. It may not be the same cancer, but it is cancer. And it's not the bad word, the bad C anymore. It's okay to have cancer, that we do okay, and that we keep on going. Knowledge is power.
Knowledge is definitely, yes, definitely knowledge is power. So I want to thank you very much for
Thank
being
you.
here. I think it's very courageous of you to do what you do, but more importantly, you smile very wonderfully. So I guess
Thank you.
I guess your husband's taking very good care of you. I see him on the other side of the camera over there. And Dr. Yee, what can I say to you? We want to thank you for your dedication, for your incredible knowledge and your care of patients. Nobody can teach you how to be kind and caring and I guess you could say whole to the patients that you deal with, but I can say it in behalf of the people that ask questions, not only about multiple myeloma, but cancer.
Right.
So thank you very much.
Well, thank you very much.
We really appreciate you coming down here. And I know it isn't too bad for you to get away from the snow of Boston anyway.
Right.
But thank you very, very much.
No, thank you. No, I've just been very lucky to have great mentors and role models along the way. So, thank you.
Well, that's the idea. That's the whole idea of getting older, is to help someone who's younger. I always say that to my grandchildren. Anyway, folks, we are at a point where I want to just tell you one more time that the only way that Dr. Yee and Mrs. Maynard can be of help to her groups is by you supporting yourself and trying to take good care of yourself. So you got to get those doctor checkups. And remember, this is your show, so if you have any questions or comments, there's a email address here and a telephone number, and we'll try to get them to those different folks. By the way, Ms. Maynard, do you have a telephone number that you want us to put up on the screen?
We have a flyer that we brought in that will go up.
All right, we'll put up the number.
With a email site, and since I work through the International Myeloma Foundation,
Right.
they have all the support groups listed for the whole state of Florida, for the whole country.
Okay. Thank you very, very much. Dr. Yee, one more time, thank you. Ms. Maynard, thank you very much.
Thank you.
Remember, folks, this is your show, and we come to you from Nova Southeastern University. I always tell you, again, take good care of yourself. This is Fred Lippman. Until next time, see you.